Redfish Healing Centre is a part of BC Mental Health and Substance Use Services, and our focus is on concurrent disorders treatment. And we also have another program called Heartwood Centre for Women, and Heartwood also provides concurrent disorders care, also team-based care. What we do at Redfish and at Heartwood is unique and important because concurrent disorders care provides simultaneous care for both substance use disorders as well as mental health concerns.
What makes this program unique is it's very holistic. So we're offering psychiatric care, we're offering addiction medicine care, we're offering primary care for people who aren't getting primary care often where they live. And then they're also receiving therapies. So it's not just medicine, it's also a wide variety of therapies, everything from occupational therapy to indigenous medicine and healing, and then of course our peer support program as well. Peer support brings something that our clinical staff aren't able to bring. So it adds a whole other layer. When a client is struggling or in crisis, staff offer a variety of ways of supporting the person, but having someone who truly understands what they're going through can bring additional strategies or emotional support or simply just being there.
The power of that relationship is what we're seeing with peer support workers.
My name is Kayla, and I'm the peer support coordinator for both Redfish Healing Centre and Heartwood Centre for Women. Being a client at Heartwood was life-changing. It was like being in a safe little cocoon where I could turn off the outside world and focus on my own healing for the first time in my life, really. Peer support work at Redfish is really about connecting with the clients. It reminds me why fighting the good fight is important. You know, it reminds me that I did survive all of this for a reason, you know, every single day.
I'm a band member from the local Coquitlam First Nations. I am 9 years sober. I enjoy giving back to people in active addictions struggling with recovery. I'd like to be a mentor to the ones trying to better themselves. I love working with clients because watching them grow, just seeing them come out of their shell, and it makes me proud that I'm being part of the change, and I just love seeing them grow.
On each unit, something different's going on every day, and we check it out to go see who needs support. You know, I sit in the lobby and I call it my office, and basically I'm checking in to see how they're doing physically, emotionally, if they need any kind of support. Because sometimes, you know, they don't want to say anything, and then sometimes they come back and they're like, yeah, you know, I'm not doing so well. Okay, let's talk about it. We want clients to participate. We want their voices to be heard. We want them to communicate. That's the biggest goal for me, is to keep them in the communication state. Keep learning how to communicate better, because that's the way you advocate for yourself. That's the way that the nurses will understand how you're feeling about your mental health. When we talk about alcohol and drug addictions, right, we want you to communicate, because that's the opposite of isolation. I'm just annoying them enough to keep talking to me. I sort of have to make fun of that because it's sort of just the way I work it until they, you know, they want to talk.
Peer supports are so valuable. They have been so valuable in my own recovery. Apart from any other therapy, I would say they are the biggest in my recovery. There's something some therapeutic value that no other thing can match, is one addict helping another addict. And we learn so much together, that trust and connection that is built on our common history.
What I think that they're bringing to the role is this evidence of success and a tangible, real person who's in front of you, who's been there before, and who's able to say, with lived experience and with insight that you can only get from having gone through it, that it is possible, and to share their experience and their encouragement and guidance.
What it logistically looks like is, for me, going on a lot of walks. I'm a big fan of walking and talking and moving while we're processing and that kind of thing.
Well, I feel we're on their level, and I think it's to be there for the clients, to say, hey, you're not alone. Walk them through to get to where me and the other supports are, and just to motivate them, to support them and say, hey, it took me 7 times, so I didn't get the first kick, and yeah, I just want to support them any way I can to keep going, focus on the main goal. I get referred to by a lot of the clients as uncle, I feel, because they look up to me, because I don't judge them, I don't scorn them. I just accept them for who they are, and it makes me feel good to be acknowledged as family.
After leaving treatment, I relapsed many times, and I continued that for about 15 years, thinking that every time that this would be different. This would be different. Now I can control it. It wasn't until the last 4 or 5 years that I started putting my all into it, and I started to try new things that I never did before. And that's when traction started to build, and I was able to get some changes, long-term changes. Today, now me helping others is a part of my journey, and it's a part of my recovery. Now I'm a peer support worker, and I can relate to clients and feel like there might be something that I've learned through this long journey that can help others.
We bring clients to community AA meetings, and we've done a lot of work on connecting clients with community resources and kind of integrating into community as best we can, and learning how to advocate for themselves and find those resources and connect. We've also connected a good number of clients with Indigenous resources as well.
Being Indigenous myself and not having any connections to anything cultural, and I don't know if I would have got it if I wouldn't come to work here. Yeah, I'm very grateful for that. The amount of Indigenous clients that come into this building, I'm so happy that they're getting the help that they need, the support they need to move forward. It's time to heal. You know, I'm learning too, right? So we can learn together on this journey.
Since the peer support workers started, I've seen people who previously were not engaging in the program begin to open up. I've seen people who we couldn't get to go to a single group or engage with a single professional, were suddenly every week going with peer support workers to off-site programming. I've seen people embrace their identity and their cultural heritage with pride. I've seen people who before were very discouraged about what the future held become hopeful. I've seen people who are applying to be peer support workers themselves. I think we're going to be flooded with applications because our peer support workers have made such an impact on the clients here that it's inspiring them to do that themselves. And I have people who we couldn't break through, we couldn't quite connect. That once they started working with the peer support workers, the entire relationship changed.
I've been at Redfish for 3 months. I came from the streets of downtown East Side, and I was heavy in my addiction, and I'm now recovering from addiction. Redfish has been really good for me. It's been a place of hope and change. I've got a lot of resilience now and tools to work on my recovery. I'm going over the peer support course with Rick. So he sits one-on-one with me, and we just go through the course together. I do want to be a peer support worker one day. Just being able to work with another person and to support them in their journey, just like how I was supported in my journey, passing that on to someone else and giving them the confidence that they can change their lives and just even work on themselves and having that hope that they can do it.
We have purpose after we've come through a lot of hardships and found recovery ourselves. And so that can also be a path for somebody, a client at Redfish. They could become a peer support worker, and that brings them a lot of hope to know that.
My hopes for the future when it comes to peer support, being involved in concurrent disorder care, but also mental health and substance use care, is that this would be integral to all models of care, staffing models in these programs. I've worked a lot in mental health where we don't have a lot of peer support in mental health. It's a little more well known in substance use recovery. So at these programs, Heartwood and Redfish, we're bringing peer support into designated mental health settings, into settings that are more mental health focused. And it's just been so incredible. We hope that that could expand to other programs and be a higher proportion of the staff. I'd love that just to be an obvious basic role you would include in any mental health or substance use program.
I see that this is just the beginning. You know, I think the combination of clinicians and now peer support, it's genuinely, I believe, the way forward. You know, we get the best of both worlds. We get the research-based therapies as well as lived experience, and we get to share what worked for us and the little tricks that work in our brains, and I hope this is just the beginning.
A big part of it is getting outside of myself and doing something better in the world than taking and taking. You know, today I'm giving back. I feel, I know it is a job, but there is a satisfaction like I'm doing something good in the world, and I feel useful, that I've learned something throughout my long journey that I can share, and it has value.
Recovery means finding myself, finding my purpose. It means healing, and just like lowering the amount of shame and things that I'm holding on to, so that I don't need to suppress as much. You know, recovery means finding my own authenticity and who I am today, and just releasing the past and releasing, it means releasing, you know, and connecting to culture and community and integrating into community, and finding people who match my trajectory.
Recovery is an opportunity and a gift. What we try to do here is we try to help people navigate it and hopefully find the gift.
You're not alone. I'm here for you. Anything you want to talk about, it could just be one-on-one, doesn't have to go any further, that I understand where you've been. I've been in your situation. I tell them this all the time, that I'm not giving up on you.
If I were to say anything directly to clients, it's that you can do this. You really can. And you are a treasure. And recovery can be fun. It can be self-discovery, and like, what am I gonna learn about myself today, you know? And it can be an absolutely beautiful process if we embrace it. And in general, about the peer support program, I think it's saving lives. I genuinely do. I think it's changing lives, it's saving lives, it's showing people a way through this, you know, and that it's possible. It's absolutely possible, and they are so worthy of it.